Hello, I am Ann Appleseth with UCS Healthcare. We're here today with another episode of our 2020 Virtual Pride FAQs. Today we're talking to TJ Guthrie, nurse practitioner at UCS Healthcare. Hi, TJ.
Hello.
Hi, well, we've got a bunch of questions, so we're just going to jump right into it. First of all, what is PrEP and who should be on it?
Sure. PrEP is pre-exposure prophylaxis to prevent the spread of HIV infection. It's a once daily antiviral pill. PrEP is recommended to be taken by anyone that's at high risk for coming into contact with HIV by not using condoms consistently with someone that has an HIV infection. People that should be on PrEP are men and women with an HIV positive partner, people that have sex with someone that you don't know their HIV status. If you or your partner inject drugs or having sex with anybody that does inject drugs, you should be on PrEP. Or if you've been told by a healthcare provider that you've had any sexually transmitted infection, you're at higher risk, and so you should be on PrEP.
Why is it important to take PrEP?
The HIV infection rate in America is growing to about 50,000 people newly infected every year.
Okay. So how safe is PrEP?
It's very safe. The most common side effects reported are like upset stomach and diarrhea. These usually resolve though after you get used to taking the medication. Long-term medication effects can affect the kidneys or liver, but that's why we draw your blood like every 3 months before you're prescribed another 3-month course.
So how would a patient get started on PrEP?
Just talk to your doctor or healthcare provider, and you would need like an HIV testing before every prescription, 3-month prescription. And that usually is just like a little finger poke, and it takes about 15 minutes for your results. And you'd have your liver and kidney function every 3 to 6 months checked. And then, and then a prescription, would be given to you.
Okay. So if a person is taking PrEP, do they still need to use condoms when they're having sex?
Only is effective against HIV infection, and that's if it's taken daily. You usually need about 5 days in a 7-day period for it to be very effective. And so if you miss a dose, it's okay, just get back on it the next day, but you need a good 5 days within 7 days for it to be very effective. And condoms will help prevent the other STDs. This only helps prevent HIV. So PrEP does not stop you from getting chlamydia, gonorrhea, or syphilis.
And what is the process for starting hormone replacement therapy, or you hear the acronym HRT?
Yeah, this is for our transgender patients. This process is really individualized, and it depends on where you are in your transition socially already. I take into account your age, your health, whether you've seen a therapist at all and for how long. But generally for the adult person that is ready to start hormones, it usually goes like this at our clinic. Appointment number 1, filling out paperwork about your health history, your medications, allergies, surgeries. You've had discussion about your gender dysphoria and what it means to you, discussion about the hormones, the types, the risks, the benefits, reading over the informed consent, the document that discusses more in detail the permanent and non-permanent changes you'll have with the hormone therapy. You'll get baseline blood work. If transmasculine, your testosterone and syringes are prescribed, and you'll bring them with you to your next appointment. You'll be sent home with an informed consent paperwork to read over many times, share with your significant others and your therapist. Appointment number 2, a long discussion about the informed consent, and if necessary, handing over a letter from your therapist recommending hormone therapy. signing the consent, reviewing baseline labs. Transmasculine patients will need a urine pregnancy test if they have a uterus prior to the initiation of the testosterone. Very brief physical exam, checking the body parts that would be affected by taking hormones. For a transmasculine person, he'll be taught how to draw up and properly inject his testosterone by the nurse. For the trans feminine person, she'll go pick up her hormones at the pharmacy and start them that day. Appointment 3 and beyond, usually 2 months after starting hormones, you'll come in for blood work and just to see how you're doing, if you're having any changes. And if necessary, we'll increase your dosage and have you back in 2 to 3 months until you're at a steady state, and then every 6 to 12 months. That's usually how we do it.
Mm-hmm. So it seems like the process in the beginning is very thorough and it's thoughtful and takes some time, which it should be. And then once your dosages are at the right levels, then it's a little more every few months. So.
Oh, sure. Yeah.
When will I start to see results after starting hormone treatment?
This again depends completely on each person. There's a little bit differences here. So like masculizing effects in transgender males, usually within a month, you're gonna start seeing like oily skin, acne, fat redistribution, your cessation of menses, clitoral enlargement, maybe some vaginal atrophy. But then like about 6 months is where you're going to have, you might start getting like the facial hair, body hair growth. You might lose some scalp hair and have an increased muscle mass and strength. But really you're not going to be finished with your puberty until 2 to 5 years, really, and, for the full effect. So it's a slow process. And then for our women, it takes a little bit longer before they start to notice some changes. It's usually around 3 months is when they start noticing some of their first things, like softening of the skin, redistribution of the body fat. They will lose muscle mass and strength. And, they might start having some breast growth around 3 to 6 months. Decreased testicular volume and decreased sperm production. Those are usually like a little bit later, 6 months or so.
Okay. So it's just a gradual process, and it's probably different for everyone. Is that correct?
It's different for everybody. And if you think about just your, it's puberty, it's a timeline there. And so, and you'll have like some plateaus and then you'll have a growth spurt and then another plateau, and
okay,
just like you did with your first puberty. And so your second puberty will be very similar.
Okay. So we've talked about some of our services that are specific to the LGBTQIA plus community. TJ, talk a little bit about what else we do at our clinic.
Yeah, well, we're a family practice clinic that cares for the whole person. You don't have to come to us just for your hormones or your PrEP. We're here to diagnose and treat all your chronic and acute conditions throughout your entire lifetime. And we want you to come here knowing you'll be treated with the respect you deserve.
That's awesome. So we've talked a little bit about the fact that UCS Healthcare is a full family medical practice, but we also provide other services like substance use disorder therapy, medication-assisted treatment, mental health therapy, psychiatric care. TJ, how is that a benefit for our patients?
Again, this covers the whole patient. Take, for example, I have a patient that is on hormone therapy, but they need a therapist and they don't have one yet. I have a whole group of people I can choose from that are right here that they can, just walk right over and see. They might also have a substance abuse disorder, and that is completely treated here. It's a combined facility, and a lot of our patients actually have multiple issues that can be treated here.
Is UCS Healthcare providing telehealth?
They are. The therapists are, as well as family practice. It'll kind of depend on what the issue is, but the person can call in and speak to the nurse, and depending on what their symptoms are, they may have them come in if it's something like I have to listen to their lungs or something, but usually telehealth, if it's something we could just discuss over the computer and you're fairly stable, you know, that's definitely a possibility to keep you safe.
Fantastic. What general advice do you have for people as a society, as we all navigate through COVID-19?
I just follow the guidelines, wear your masks all the time, wash your hands very frequently, keep your social distancing, isolate if you can, only go out if you absolutely need to. And, you know, so far it's worked for us.
Very good. Well, TJ, thanks so much for your time. If we have other questions about general health care, about PrEP, HRT, integrated treatment, feel free to call or email us at UCS Healthcare, and we have great providers like TJ that can answer your questions for you. Thank you.